Hi, we're talking to occupational therapist Joy Anderson today. Hi, Joy, how are you?
Hi there, Joanne. I'm good, thank you.
Joy, let's talk a little bit about occupational therapy when it comes to children. What are fine motor skills and what are gross motor skills?
Okay. Well, motor skills in general are any kind of movements that we do throughout our lives. And they are broken down into fine motor skills, which are more kind of delicate, intricate movements that might be done with kind of your hands, so more dexterous movements with your hands. And gross motor skills are larger movements that are kind of bigger movements with the legs and that kind of thing. So within fine motor skills, it might be activities like being able to use scissors, writing, being able to use cutlery, and when we're dressing, being able to do kind of fastenings, the buttons, the zips, those kinds of things. So manipulating those kind of small objects and being able to control them appropriately and efficiently. And then gross motor skills might be things like being able to balance, your posture, having the stamina, so being able to keep going with things, having that body awareness, so things like maybe walking up the stairs, doing sports, kind of weight bearing, all those kind of larger movements. And from an occupational therapy perspective, looking at those skills in terms of function, so not can a person just do a repetitive movement, but how does their fine motor skills and gross motor skills impact on their ability to function in day-to-day life. So all those activities of daily living that they have to do or want to do. So those hobbies, the productivity, the self-care, all those skills, how those fine motor skills and gross motor skills impact on a person's ability to do those things.
What are some of the signs that my child may need to see an occupational therapist?
Again, it's very broad because an occupational therapist would see clients from a wide range of different sort of difficulties. But basically, an occupational therapist is needed if an individual's engagement in day-to-day life is impaired in some way through sort of illness, disability, social problems. So for a child, it might be looking at the person's engagement in school. So are they struggling to engage with the other children? Are they struggling to concentrate? Is their handwriting very poor in PE? Are they really struggling with those kind of movements? Within their hobbies and their leisure activities, would they much rather kind of do they have a broad range of engagement in different activities with hobbies, or is it restricted? Or do they struggle with completing them? So compared to their peers, they're really struggling to complete things that as a child they're wanting to do and they should be able to do. And again, in self-care, are they needing a lot more assistance maybe than their peers might do to engage in those things, and not maybe doing it to the degree of independence that you would expect for their age, and how much it's affecting them and their lives and their self-esteem as well if they're not able to do things that their peers are able to do. And I think from an occupational therapy perspective.
Sorry. What ages do you work with? Is there like a specific age that would be too young to say somebody needed occupational therapy?
To be honest, no, because even from a baby, occupational therapists can work with the parents to facilitate the normal kind of typical development of a child. So if the child had difficulties from a very young age, the occupational therapist could work with the parents to support them in the process of facilitating as normal development as you would want for the child. And then occupational therapists work completely across the board up to sort of 100 plus from being a baby, so really across the board. As a paediatric occupational therapist, I work with people up to about age 19 generally, from a very young age as well.
When you're working with children, how important is the parent involvement in the whole treatment process?
Absolutely essential. I mean, if a child has some kind of illness, disability, whatever their difficulties are, it's going to impact upon them, but also on their relationships with their family as well. So getting the parents involved is really important in terms of setting goals. So we'd work with the child and with the parents to look at what areas of their life that the most difficulties are with, and that being a starting point and working our goals towards that. So not about what I think is important, but actually what's important to the child, and what the parent's viewpoint is obviously paramount within that, because the parent is the expert in that child. So that's a really important role. And then also working with the wider family, so grandparents, siblings as well, because again that relationship's going to be affected by the illness or disability, whatever the issue is that you're kind of coming to therapy for. So it might be kind of involving the whole family, so that everybody's supporting each other, and working together to facilitate that independence and that engagement that we would be looking for from the therapy.
What would be involved in an occupational therapy evaluation?
Again, this would be quite varied according to what specialist area you're working in within occupational therapy. So occupational therapists work within mental health, physical health, within communities and more sort of inpatient units. So I think there'd probably be a degree of difference within those assessments. But primarily we'd be looking at functional skills within activities of daily living, so that productivity, leisure, self-care, the person's routine, and looking at the underlying skills that might be a barrier to engaging in those areas. So looking at their physical skills, so again like their fine and gross motor skills, their social communication interaction skills, and their sensory processing skills, and their perceptual skills, and looking at their behaviours, what the purpose those behaviours might be serving, and if they are sort of inappropriate, looking at how we can support the child to find alternatives. So generally kind of the focus being engagement in what the child wants to do and needs to do within their life, but then looking at the underlying skills within that.
Thank you, Joy. Thank you so much for speaking to me.